eye, not only save the eye, but also the life of the child when we pick it up early, retinoblastomas, and provide a comprehensive treatment with brachytherapy at our Bangalore hospital. And our donor has said, Doc, any number of children with cancer of the eye from the poorer families, whether it is 100 or 1,000 or 10,000, let us treat absolutely free of cost. That is what is happening there in Bangalore Shankara Eye Hospital. 1998 was a landmark in the history of Shankara, when the Shankara Eye Foundation was formed in the United States with all our friends who are here. And all of you now, every one of you is Shankara Eye Foundation. All of you are Shankara Eye Foundation. The way you have come forward wholeheartedly to be a part of this great movement has made history back home in India. We have long-term mission partners. The Infosys Foundation said, we would like to be a partner with you in Bangalore. The Robert Bosch Foundation from Germany said, we would also like to be with you. The Rotary International, Rotary here in Cupertino and Palo Alto, they said, we would like to be with you. So all of them came and joined hands with us. Believe me, when the cause is genuine, there are any number of people, like-minded people, who are willing to join the bandwagon. The next area of activity is diabetic retinopathy program for rural India. Diabetes is no more the disease of the rich. Even in the villages, at a relatively younger age group, we see many patients suffering from diabetes, and the first organ to get affected is the eye. So we have a program by which we screen the diabetic patients in villages, identify those who have the problem, and bring them to the base hospital to provide lasers or surgery as indicated. In the year 2003, Shankara Eye Foundation gave us a challenge. It was, they said, Vision 20 by 20 by 2020. We said, they told us, why do you want to restrict yourself to Tamil Nadu? Should you not share your experience and expertise for the benefit of every single state in India? Come forward. And we said, Vande Mataram, the program titled Vande Mataram. We started it with a goal of Vision 20 by 20 by 2020. Yes, it is an obsession. It is a magnificent obsession. And we are optimistic that it will happen over the next few years. Scaling up has happened. Looking at the India map, Mother India, you would realize those states which are just marked in white, that one strip in between is what is remaining. And nothing prevents us from complete it and make that also reach all the states with quality eye care. We have the integrated hospitals. That is the major hospital are called the integrated hospitals. The mission headquarters is in Coimbatore in 1977. We have one in southern India, close to Madurai, a place called Krishnan Kovil. There we have a hospital. Andhra Pradesh, the first replication took place in a city called Guntur in coastal Andhra Pradesh. It is a success story. The Tana and the Telugu families in this part of the country, when we came and when I addressed Shankara Eye Foundation, said, Doc, you come here, come and address the Tana and the Telugu people. I challenged them. If 1,000 families of Andhra origin living in the United States, if each one of you can come forward with $1,000 each, we will make it happen. Believe me, in 3 months, they raised $1 million. So the first replication happened in Andhra. Today, it is a success story. In that 225-bed hospital, we do not have space at all. Patients are waiting in the queue. The hospital has gained such a good name, many more people want to get the benefit, and the hospital is self-sustaining. We have made it a self-sustaining hospital. It is 125% self-sustaining with 80-20 model, about which I'll talk to you later. So Andhra was the first replication outside the state. Then came the Bangalore hospital, one of the most modern hospitals established in Bangalore in the state of Karnataka. Then we went to coastal Karnataka in the northern part, and that is Shimoga. At Shimoga, we have yet another 225-bed hospital. Then we went to Gujarat. The amount of support we received from the Gujaratis, earlier for Karnataka, the Akka, the American Kannada Kalkutta people, and a host of Kannadigas living here, they said, we'll be part of you. And what happened? Those who held the TANA and the Telugu Association and others who helped the Andhra hospital said, yes, we are not stopping with that. We'll help your Bangalore hospital as well and the Shimoga hospital as well. That's how we have a hospital in Karnataka. Then we went to Anand in Gujarat. A wonderful state. There we have put up a 225-bed hospital, and it was inaugurated by none other than believe me, he's a phenomenon. He is a phenomenon. Something which is very good has happened to India is Narendra Vais as the Honorable Prime Minister. He came and inaugurated. He took part in every function. All our Shankara Eye Foundation people were there. And immediately after that he said, Doc, every time you come to Anand, come and meet me, not in my office, in my house. I minimum spend about an hour with him every time when I go to Gujarat. I tell you the amount of openness, the basic idea for him to develop at that point of time, it was the state of Gujarat, now it is Mother India. Next we went to Ludhiana, Sat Sri Akal. We started saying Namaskaram and Vandanam first. Then we went to Andhra and I started saying Bhagunnara. By the time I started learning Telugu, I had to go to Kannada, Chennai Dira. And then moved on to Gujarat. Kem Chau. And in Punjab, we said Sat Sri Akal. India is a wonderful country. It's fascinating to see how all these people, Malayalis, Gujaratis, Kannadigas, Andhras, Bengalis, have all lived together, distinctly remaining their own qualities, yet they're all Indian at the heart of hearts. Ludhiana came up, followed by the Uttar Pradesh Kanpur Hospital. October 12th this year, the Kanpur Hospital, beautiful hospital, has been inaugurated. Government of India has done a study to say that under the National Program for Control of Blindness, those states who got a high incidence of blindness and low cataract surgical rate, and these are all the states, Uttar Pradesh, Rajasthan, Madhya Pradesh, Bihar, Chhattisgarh and Jharkhand, and our concentration, the next 5-6 hospitals will be in these states. Next. We have a managed hospital in Rishikesh. Rishikesh in Uttarakhand, we have at another hospital. Then we have the city hospitals. We have one in Vijayawada in the state of Andhra Pradesh. Next. We have one more in Coimbatore in Araspuram, the heart of the city. We have one in Mumbai in Malad West. We have one in Kanpur city apart from the Kanpur base hospital. The future, Rajasthan, Madhya Pradesh, Chhattisgarh, West Bengal, Odisha, Bihar. And as Muraliji said, the priority depends how fast we are able to raise the funds, that states. And from now on, our replication is going to be 2 hospitals per year. We have had the experience. We have come a long way. We have learned by replicating, and now we know how to make a quick, a sustainable, and a renewable model in a new state. So 2 hospitals will be replicated every year. History of success, already the MC quoted the numbers. Nevertheless, the numbers every day, it goes up by 500 in terms of surgeries. It goes up by few thousand in terms of screening. 18,000 camps conducted. 3.3 million screened, 1.2 operated, men 44%, women 54%, children 0.5%, 98.8% success rate. It is not the number alone. It is not just enough to say million people have been operated. How many of them got the best of vision? Why million people came to Shankara after all? If in a village which is a small community, if one person had not had a good vision, believe me, others will not come anywhere near you. the proof of the pudding is in eating. They have to have the results. And at Shankara, we are very, very happy to say, very proud to say, our success rate, while the World Health Organization says 91% is the maximum achievable, we did 98.8% success rate. 96% of the patients are having the ability to carry out their personal activities. 68% patients can do domestic help, and 64% of the patients are back to work after surgery. When you give vision to a child, my dear friends, you are giving the next 80 to 85 years of productive life. When you give vision to an adult, you make him or her the breadwinner of the family. When you give vision to an elderly person, you make him or her do the regular day-to-day activities. They don't have to depend on other breadwinners of the family. Giving vision at any age is something remarkable. What is special and unique about Shankara? The organization. We have a governance model. Our organization structure. We have the board, we have a steering council of eminent people from different walks of life guiding us. We have presidents, and all our presidents are in their late 30s or early 40s. Dear friends, we have a strong second line, highly motivated second line taking the torch forward. And every hospital has got its own functional areas, key performance indicators, balanced scorecard. They are monitored. In fact, much more than any other corporate hospital, we do have processes and systems in Shankara. For service delivery, there is a standardized protocol and monitoring at every level. Human resources